My name is Jesus Dominguez and I'm an HDR UK researcher in clinical trial informatics. I am going to introduce you to the core concepts surrounding computable guidelines, the importance they play in aiding clinical decision making, and the issues to be considered in the development and maintenance of any computable guideline. Clinical guidelines are intended to assist healthcare professionals and patients in making appropriate care decisions. They are written in the format of a peer-reviewed journal article, offering a convenient way of packaging scientific evidence, summarizing medical literature, and presenting recommendations about the treatment or management of a specific disease. It has been shown in rigorous evaluations that clinical guidelines optimize the quality of care, standardize clinical decisions among practitioners, and reduce healthcare costs. However, for clinical guidelines to be effective in daily practice, they must be integrated with organizational systems and clinical workflows, as well as provide patient-specific advice whenever and wherever needed. There are general limitations to the use of clinical guidelines in narrative form. The first one concerns dissemination. Practitioners must be aware of new or revised clinical guidelines being released in order to use them. And although healthcare professionals are provided with continuous development to regularly update knowledge and skills, there are above 7,000 clinical guidelines in circulation. Another limitation is that a physician or nurse has no time to read several pages of dense technical medicine while treating a patient. Algorithms and models to aid the development of recommendations exist within clinical guidelines, yet these are not always published in a format that is suitable for clinical guideline users. And how to adapt a clinical guideline for a particular condition to a patient that has additional conditions and is already taking other medications. Clinical guidelines cannot just be used. They must be carefully adapted to the patient's phenotype, clinical history, and current situation. Computable guidelines are representations of narrative-based clinical guidelines in structured formats that are interpretable by computers. These computable guidelines need to be developed and integrated into a clinical decision support system. Clinical decision support systems are computer programs that interpret and execute computable guidelines and, when well designed and implemented, have been shown effective in improving practice. The adoption of modern information technologies like electronic health records and clinical decision support systems has enabled the integration of up-to-date patient data with local clinical guidelines. As a result, the produced knowledge can simultaneously achieve a standardization of clinical decision-making among users and personalization of patient therapy. There are many types of decision support systems in regular use, such as diagnostic reports, medical alerts and reminders, tools providing guidance on prescribing, and more complex systems that combine knowledge taken from several clinical guidelines to assist in the management of patients with multiple clinical conditions. In summary, we claim that computable guidelines allow easier integration of evidence-based clinical recommendations with the daily clinical workflow of a practitioner, which as a result should improve a practitioner's compliance with clinical guidelines and patient outcomes. Translation of narrative-based clinical guidelines into computer algorithms is not an easy task. In addition, the integration of guideline systems with diverse electronic health record systems is difficult to be generalized. A potential solution to these problems is the development of common models for guideline representation. Guideline representation models can support the verification and validation of clinical guidelines.